From the San Francisco Public Press, you're listening to Civic, where we investigate the policies and institutions that govern our lives. San Francisco is confronting a scourge of overdose deaths, and there's no clear remedy in sight.
I lost 3 friends all in 1 month, really close ones, from the fentanyl overdose.
And as people get angrier and more vocal, some politicians are shifting the blame onto those most harmed by the crisis.
They shouldn't have to see someone sticking a needle in various parts of their bodies, laying out on the streets.
But pointing fingers doesn't explain why fatal overdoses are plaguing the city. So we're investigating the root causes of the overdose epidemic, what's being done to help, and what might be making things worse. I'm Sylvie Sturm, and this is Civic. A report by San Francisco's chief medical examiner shows that from January to June this year, 406 people died of accidental overdose in the city. That's more than 40% higher than the same period last year. At this rate, the number of fatal overdoses in 2023 could surpass every other year on record. The Black community is affected much more than the rest of the population. While Black people account for 5% of San Francisco residents, they made up more than 30% of overdoses. What this disparity clearly shows me is that harmful substance use and addiction is rooted in deeply entrenched systemic problems. As a journalist, I wanted to find out what was really going on and what led us here. I talked to more than 40 experts in healthcare, advocacy, government agencies, and with lived experiences. I read 100 academic studies and 100 reports and scoured news archives going all the way back to the 1800s. I also reached out to Mayor London Breed, Tenderloin District Supervisor Matt Dorsey, and Supervisor Asha Safai, who's campaigning to replace Breed. None of these elected officials responded to my requests for comment. To report on everything I learned, we're launching a series called San Francisco and the Overdose Crisis. First, we take a look at what led to rampant opioid use, addiction, and drug-related deaths, the toll it's taken on San Francisco's most vulnerable residents, and how the city is responding. Susan Lefevre lived on the streets for 10 years while taking drugs.
And one thing I learned was not to tell 911 that somebody's overdosing because you'll be the last person on the call. The stigma of drug users, they're not being productive in society, they're taxpayers' money, so on and so on. So it's all that judgment.
Her situation was not uncommon. More than 4,000 people who experienced homelessness in San Francisco in 2022 also had a substance use disorder, according to a city report. She said that people who haven't experienced both addiction and homelessness don't understand how it feels to be judged and vilified by people who walk by.
What they see on the surface is everybody doing drugs, and they don't want to work because they're too lazy because they want to do drugs. And what the real case is, about 90% of us, is that we come from a messed up place. And I mean a real messed up place. And so we do drugs by legal or illegal means to help cope with that messed up place. And when people mistreat us the way they do, it adds to that messed up place that we came from.
Lefevre talked about the deeply traumatic and abusive childhood she endured at the beginning of a lifetime of struggle.
I was adopted from Korea by a Caucasian family in Ventura, California. And by the time I was 14, I was put back into the foster home. And my dad, who happened to be in law enforcement, on the day of his arraignment, they were going to charge him with 16 counts of child molestation. And he ended up committing suicide the day of his arraignment, with a suicide note that he left saying it was my fault. And I was 14. So that's just the first part of the trauma.
But as people in distress line the streets of the Tenderloin and south of Market in growing numbers, some of them taking drugs in full view, San Francisco's reputation as a compassionate city seems to be eroding. Mental Health SF is a new city agency that was formed to address the homelessness and addiction crisis. Their numbers indicate that nearly 19,000 residents experienced homelessness at some point in 2022. Of these, nearly half suffered from addiction or a serious mental health disorder. 3,000 people struggled with both, and they're dying at a terrifying rate. Nevertheless, some elected officials are suggesting that homelessness and serious substance abuse and mental health disorders are lifestyle choices. Supervisor Matt Dorsey, who's in recovery himself, recently tweeted, quote, "The most important, most compassionate, most life-saving message we can send is this: the party is over," end quote. And Mayor London Breed, whose sister died of an overdose in 2006, has repeatedly said that compassion is killing people. When she talks about homeless people who use drugs, she paints a horrific picture of streets full of dangerously unstable people.
The most important job that I have as mayor is that when people walk down the streets of San Francisco, they should feel safe. They shouldn't have to look over their shoulders. They shouldn't be punched in the face randomly. They shouldn't have to see someone sticking a needle in various parts of their bodies, laying out on the streets and wondering, what can I do to help them? They shouldn't be spit on. We have to have an honest conversation about people who suffer from mental illness and substance use disorder, and someone's right to do so.
Someone's right to suffer from mental illness and substance use disorder? Breed seems to be implying that people are choosing their misery. Or at least she's saying that, because of their complicated circumstances, the city should be allowed to override their autonomy and agency. And she seems to be prioritizing the people witnessing suffering over the people experiencing suffering. The Centers for Disease Control and Prevention warns against this type of stigmatizing language. The federal agency made a podcast on the subject featuring Brittany Curtis, a health communications specialist in overdose prevention.
Stigma can look like blaming someone for their suffering or assuming that their addiction is a choice that the person makes. And we know that stigma can be very harmful and can prevent people from asking for help when they really need it. Addiction is a disease. It's not a character flaw. Therefore, overcoming a substance use disorder is not as simple as just resisting the temptation to take drugs through willpower alone. When people take drugs, the brain is actually being flooded with chemicals that take over the brain's reward system and causes them to repeat behaviors that may feel good but aren't healthy. The brain adapts to continued drug use by developing a tolerance, which means it may take more of a drug to feel the same result. And so this is also why drug addiction is a disease that can often result in relapse.
Susan Lefevre read me a poem she wrote that conveys what it feels like to be misunderstood and denigrated.
When demons look for weak souls to devour, they come in all forms, shapes, and disguise, using your pain to attack your mind, bringing to surface all the past and present PTSDs, and people judge on the surface of what they see. But they don't think to ask us, because all they see is us doing drugs, and they have no clue how that came to be.
She now lives in a supportive residential building in the Tenderloin, the same neighborhood she spent all those years living on the streets. When people talk about streets teeming with open-air drug use and tents lining sidewalks, they're usually referring to the Tenderloin. Nearly a quarter of all drug-related deaths happened there last year. The 30 blocks that make up the district have become notorious for media reports like this one from KPIX.
It is encampments and people in obvious crisis with seemingly no intervention at all. The Tenderloin looks a lot like a city wrestling with an emergency decades in the making.
The truth is, it was decades in the making. It's a result of generations of events that turned this part of town into a containment zone for vice, graft, and corruption. In fact, corruption is the widely accepted explanation for the origin of the name Tenderloin. It was said that officers patrolling the neighborhood could afford the more expensive cut of meat from all the bribes they accepted. In the 19th century, the Tenderloin was the city's raucous entertainment hub, filled with theaters, hotels, brothels, and fine dining. Then, the Great Earthquake of 1906 ignited fires that burned the Tenderloin and other eastern neighborhoods to the ground. Much of San Francisco was reduced to heaps of rubble and ash, and it needed a ton of workers to rebuild. To house those workers, developers built residential hotels with small rooms, also known as SROs, or single-room occupancy. These inexpensive hotels also attracted immigrants, transient workers, and low-wage workers. Tenants included gold prospectors in the mid-19th century, seafarers during their months ashore, fruit and vegetable pickers in the off-season, and laborers on short-term jobs. The flood of young, working men making good money quickly attracted a bustling nightlife with bars, gambling halls, and brothels. Single working women also moved into this new kind of affordable housing and bucked social norms by patronizing bars unaccompanied. From that long ago history to this day, law enforcement and city officials have vacillated between cracking down on illegal or immoral activities in the Tenderloin and allowing it to become a containment zone for vice. In future episodes of this series, we'll take a look at that long, fraught history of police crackdowns and how they still affect us today. But back to the Tenderloin, we see that starting in the 19th century, its fate was to become a refuge for underprivileged residents, those living non-traditional lifestyles or pushed to the margins of society. As such, it also attracted benevolent people who felt a calling to help. In 1950, a Franciscan friar opened St. Anthony's Dining Room. It was the first of many humanitarian projects and nonprofit efforts established in the district. Among the most famous is Glide Memorial Church. Founded in 1963 by Reverend Cecil Williams, the church welcomed people experiencing homelessness, famous supporters, and political activists like Angela Davis. Glide is still spreading humanitarian aid, along with more than a dozen other nonprofits providing supportive services in the neighborhood. Today, the Tenderloin has, by far, the highest concentration of social agencies in the city. Tenderloin residents have dealt with marginalization, neglect, and poverty for generations. And throughout that time, drugs and alcohol were always part of the neighborhood story. In 1898, an English chemist discovered a process to produce heroin from opium. By 1914, reports of widespread addiction across the country spurred Congress to ban its non-medicinal use. But that wouldn't suppress its popularity. By 1950, heroin was a staple in San Francisco, especially among the city's emerging community of artists and poets known as beatniks. But the most notorious time for drugs in San Francisco was yet to come. The 60s and 70s. This was the counterculture era, a time when 30,000 people gathered at Golden Gate Park in June 1966 to hear LSD guru Timothy Leary say,
The message is very simple. 6 words. Turn on, tune in, rock out.
Hippies were known for taking psychedelics and weed, but heroin was also used to a lesser degree. Opioid use remained relatively stable throughout the 1970s, and then it even fell slightly out of favor in the 1980s as cocaine and crack use surged. But in the 1990s, opioid addiction was on the rise, and San Francisco started on the path towards the fatal overdose crisis we're facing today. In the 1990s, an idea was trending that Americans were suffering from an epidemic of chronic pain. It was severely affecting their quality of life with significant suffering, disability, and social isolation. Some medical associations started pushing the idea that pain should be seen as the 5th vital sign, that it should be checked as often as blood pressure. That's when you started seeing those pain charts on hospital walls, the ones with a row of numbered cartoon faces with expressions ranging from happy to excruciatingly pained. At the same time, the pharmaceutical industry was eager to boost sales of a new kind of painkiller, oxycodone. Before this, doctors prescribed opioids like morphine for only the severest cases of pain. But companies like Purdue Pharma said doctors should prescribe their opioids for any kind of pain. They said their new drugs could be used without fear of their patients becoming addicted. The company sent out glowing patient testimonials like these.
I got my life back now. Now I can enjoy every day that I live. I can really enjoy myself. And before, even a good day was hell. I mean, I couldn't enjoy nothing. But now I can enjoy myself. That's when I say it's wonderful. I look at the future the same way a young guy, 25, 30-year-old would.
Since I've been on this new pain medication, I have not missed one day of work, and my boss really appreciates that. Lauren is there every day, so I'm able to be very productive.
When I started taking oxycodone 2 months ago, it was the first time I had felt normal since my original injury 10 years ago. All that time I had suffered greater or lesser extent of pain, and now I feel absolutely normal.
The company also sent tens of thousands of testimonial videos featuring pain experts like this one.
The main area that we can improve on, and the approach that's available to every doctor with a prescription pad, is just for us to do a better job of prescribing strong pain medications, and I mean opioids.
Patients may be afraid of taking opioids because they're perceived as too strong or addictive. But that is far from actual fact. Less than 1% of patients taking opioids actually become addicted.
But that was all a lie. Oxycodone actually had a much higher potential for addiction, abuse, and misuse. In fact, dependency can form within just a matter of days. That's because of how fast it gets to the brain. Addiction experts say that the quicker the pleasure, the more addictive. Oxycodone is on par with heroin at getting to the brain, and it's 7 times faster than other opioids. Those patient testimonials that we heard a minute ago, well, 15 years later, reporters from the Milwaukee Journal caught up with those patients. They learned that the man we first heard from had died a few years earlier when he crashed his truck while under the influence of opioids. This is his stepdaughter.
He took the medicine and hopes that was going to change things, you know, but he had no idea. I knew he would have never stayed on it. He would have never got on it if he knew how he would have ended up, you know, years later.
Pharmaceutical companies knew about oxycodone's nearly instantaneous addiction phenomenon. But doctors who were either misled or influenced by eager pharmaceutical sales reps continued to recklessly increase prescriptions. This is the woman we heard earlier say that the drug helped her get back to work.
Eventually, it stopped working, and it got increased. I think it was 40 in the morning and 40 in the evening. And then eventually that got increased. This went on for years. I lost my job and I lost my insurance. So it got to the point where I couldn't afford it, and I didn't buy it one time, and that was the beginning of the end for me, because I could no longer afford it. But the time that I went without it was probably the most unbelievable, excruciating, horrible time of my life. The withdrawals were just unbelievable. I just knew eventually I'd probably kill myself, OD, taking this medicine.
A surge of addiction and a steady rise in fatal overdoses overtook the country. Soon, local governments began to take notice. Law enforcement began cracking down on so-called pill mills, places posing as pain management clinics where physicians illegally prescribed painkillers without physical exams or documentation. In 2010, prescriptions of opioids peaked, and they've fallen ever since. But it was too late. The scourge of opioid addiction had already taken hold. David Kahn is a forensic psychiatrist specializing in addiction. Last May, he addressed a California State Assembly committee dedicated to overdose prevention, which was chaired by San Francisco Representative Matt Haney.
Paradoxically, prescription drug monitoring programs, when you take people off of controlled regimens for chronic pain, you drive them to the streets. You drive them to heroin, you drive them to fentanyl, and also critically unsafe supply.
From 2006 to 2016, the number of people who injected drugs in San Francisco went from fewer than 10,000 annually to nearly 25,000, according to the Department of Public Health. It's important to note that this was also during the 2008 economic meltdown. The recession drove millions of Americans across the country into unemployment and foreclosure. That catapulted levels of poverty, homelessness, and despair. And the impact was especially acute in the Black population. A Brookings Institute study showed that during the economic downturn, Black families were hit nearly twice as hard as white families. It showed that from 2007 to 2013, the median wealth of Black families fell by 46% versus 25% for white families. That's because way more Black families didn't have the means to buffer an economic shock. Today, the ratio of white wealth to Black wealth is higher than it was even at the start of the century. The stress, anxiety, despair, and depression linked to poverty take a heavy toll on physical health. Several studies also showed that economic insecurity adds to rates of chronic pain and to problematic drug use. One study on the impact of the 2008 economic crisis in European countries had staggering results. It showed that from 2008 to 2010, the number of people with problematic drug use aged 35 to 64 increased by 88%. So illegal drug dealers now had a booming market among people who no longer had prescriptions, and many were dealing with personal trauma, racism, poverty, displacement, and homelessness. In 2008, San Francisco voters decided to take action. They passed Proposition T, mandating that the city provide addiction treatment on demand for everyone seeking it. In future episodes of this series, we'll take a closer look at what options are available for people who want treatment and why it's not always so easy to get into rehab. Despite the Treatment on Demand Act, the addiction crisis would only increase and become even deadlier. That's because illicit drug manufacturers figured out how to boost profits by increasing drug potency using the powerful synthetic opioid known as fentanyl. Fentanyl first gained notoriety when it began causing a fatal overdose surge in the eastern United States in 2014. It made its way to San Francisco around 2015, and within 3 years, it had pervaded the drug supply. Keith Humphreys is a professor of psychiatry and behavioral sciences at Stanford University. He also addressed the California State Assembly on overdose prevention last May.
How did this drug become so dominant? Well, we talk about disruptive innovations all the time in Silicon Valley. This is a disruptive innovation in illegal drug markets. It is unlike heroin, morphine, or any other illicit opioid in that it doesn't require agriculture. There's no farm anywhere. All the supply chains are gone. That means it can be made far more efficiently and cheaply for traffickers. In the end, fentanyl is probably going to outcompete heroin to the point that there is no heroin left in illicit drug markets in California. This has happened back east. This can happen here because the profit margin is so large. The other thing about fentanyl is it's so potent that people use it more and more each day than they would even heroin. So it's cheap to make, people use it a lot, that makes it very profitable.
Reports skyrocketed that people were dying after taking another substance, like cocaine or heroin, that was surreptitiously laced with fentanyl. In one instance in 2017, the San Francisco Department of Public Health issued a health alert after 12 people who thought they were taking cocaine were poisoned with fentanyl. 3 of them died. Susan Lefevre talked to me about what it was like for her to suddenly lose so many people she knew and cared about.
When they get high, they do their normal intake, not realizing there's fentanyl in it. I actually was depressed for a minute because I lost 3 friends all in 1 month, really close ones, from the fentanyl overdose. I feel like that God was looking out for me. You know, I can't be like mentally kind of sort of where I'm at without having some type of faith. And so I really believe that God was looking out for me when it came to that.
People also died after willingly taking drugs laced with fentanyl. That's because it was impossible to know how much of the potent opioid was in the substances they were using. Lefevre is now saving lives while participating in a program that responds to calls for help when someone is overdosing in her supportive housing building. In a future episode, we'll take a closer look at this peer responder program and why it's been so successful. But before she could help others, Lefevre first had to find stability in her own life. And that came when she secured supportive housing in an SRO leased by the city. Everyone I talked to, from harm reduction advocates to medical professionals to legal experts to rescue workers, they all agree homelessness is among the major driving forces of addiction, and housing is one of the best solutions for addressing the drug crisis.
We need housing with supports where people can get supported and stay there even while they are continuing to struggle with substance use disorders of all kinds and mental health issues. The way that people get off the street is by getting into housing with supports.
In our next episode, we'll investigate the events that contributed to San Francisco's widespread homelessness and how the poverty and suffering in the streets connect to drug use and fatal overdoses. I'm Sylvie Sturm, and you've been listening to Civic. Civic comes to you from KSFP LP 102.5 FM in San Francisco. This episode is part of a series on San Francisco's overdose crisis and prevention efforts underwritten by a California Health Equity Fellowship grant from the Annenberg Center for Health Journalism at the University of Southern California. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Swing Rhythm Gitane by Lache Swing was provided by the Free Music Archive under the Creative Commons Attribution License. Our team includes producer Leanna Wilcox and contributor Mel Baker, who is also the program director at KSFP. Cynthia Chavez is our vocal coach. KSFP is a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find our reporting at sfpublicpress.org. Our staff includes publisher Lila LaHood, executive director Michael Stoll, development director Lisa Rudman, copy chief Kurt Aguilar, photojournalist and reporter Jessica Prado, and reporter Madison Alvarado. Civic airs Tuesdays and Thursdays at 8 a.m. and 6 p.m. on KSFP. New episodes on Thursdays. Subscribe to our podcast by looking for Civic from the San Francisco Public Press wherever you get your podcasts. We're the one with San Francisco's skyline in our logo. Sign up for our newsletter by going to sfpublicpress.org/newsletter. Thanks for listening.